Okay, I see we have a few folks who just joined us. We're just asking that you indicate if you have any questions in the chat or if you need recording permissions. I believe the permissions that were requested so far have been granted. So, Dr. Vanderhoff, we will now hand it over to you to begin today's press conference.
Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Well, the calendar, at least, if not always the weather, tells us that spring is upon us. Traditionally, spring is when we begin to see respiratory illnesses start to decline, and that's exactly what we're seeing in Ohio right now. The rates of COVID-19 and RSV have been declining dramatically in recent weeks. Last week, there were 2,719 COVID cases reported statewide. That was a 40% drop from what was reported just 2 weeks earlier. COVID hospitalizations and deaths have also been decreasing. Influenza activity is also beginning to decline in Ohio. The CDC last week downgraded Ohio's flu activity from very high to high. The number of flu-related outpatient visits dropped 23% last week, and the number of hospitalizations similarly dropped 24%. These are welcome signs, but we can't let our guard down, especially while flu rates are still high. It's very important to continue to practice common sense prevention steps, such as staying home if you feel sick. Then please avoid being around other people as much as possible until 24 hours after you're both fever-free and your symptoms are improving. COVID vaccination, of course, remains an important consideration. Last month, the CDC endorsed a recommendation from the agency's advisory committee that adults 65 and older should receive an additional updated dose of the COVID vaccine that became available in September, as long as it's been at least 4 months since someone has had their last shot or 3 months since they've had a COVID infection. It's important to think about this new updated version of the vaccine that became available in September as truly a new vaccine. And an additional shot now will shore up protection for those 65 and older who are more vulnerable to COVID-19. So far, 11.3% of Ohioans, including about 34% of those who are 65 and older, have received this updated vaccine. Yesterday, Governor DeWine and his wife Fran got the updated COVID vaccine. They also got their tetanus, diphtheria, and pertussis vaccine updated, which really highlights the importance of staying up to date with all of our vaccines. Now, here is a short video clip of the governor from yesterday.
So, Mike, you're going to feel a stick. Okay? Just like that. All done. All right.
We want to thank Governor DeWine and Mrs. DeWine for sharing their experience with us, and we hope it encourages more people to stay updated on all of their recommended vaccines. In the case of the COVID shot, this will ensure maximum protection against a virus that is still very much in circulation and is claiming the lives of dozens of Ohioans every week. The final virus I want to provide an update on today is measles. I talked about this disease last month, and I want to reinforce the message today because there have been sizable outbreaks overseas. Inevitably, in this global environment, that means cases have surfaced in the United States and in Ohio. We cannot think of ourselves as isolated from these international outbreaks. Last week, the CDC announced that the number of confirmed measles cases in the United States in 2024 is already 58, the same number that we recorded in the entirety of 2023. In Ohio, we now have had 5 confirmed cases, 2 each in Montgomery and Miami counties, and 1 in Richland County. It's very important for you and your loved ones to be up to date on all vaccines, including measles, mumps, and rubella, or the MMR vaccine, which is highly effective. I encourage everyone to talk to their healthcare provider about their vaccine status and what vaccines might be recommended for you. Well, we are less than 2 weeks away from a monumental event here in Ohio, the solar eclipse. It will travel through the state on April 8th. As you may know, many Ohioans will have a front seat for a total eclipse. All or part of 55 counties are in the path of totality, while those in our other 33 counties will also enjoy at least a partial eclipse to view. And this is a very exciting event for our state and for many of us, truly a once-in-a-lifetime opportunity. At the Ohio Department of Health, our main concern is with eye safety. I want to caution all Ohioans that it is never safe to look directly at the sun, even during the brief period of totality, which, depending on where you are, could be a matter of 2 to 4 minutes. The moon blocking the sun can move ever so slightly, and even a quick change and a quick glimpse during that can cause immediate and permanent damage to your eyes. The good news is there are safe ways to view the eclipse. One way is to ensure that any eclipse glasses that you may have acquired or are going to acquire have the approved safety standard marked right on the eyewear. And what you should look for is the ISO 12312-2 marking. I'll repeat that. That's ISO 12312-2. This is very important. Sunglasses are not safe eclipse viewing eyewear, nor are cameras, binoculars, or telescopes. We have information on safe eclipse viewing on our Ohio Department of Health website, and we will share that link in the chat right now. It includes links to several organizations that have compiled lists of where you can find approved eclipse glasses. Another safe option for watching the eclipse that some of us might enjoy is by visiting NASA's website. The agency plans to live stream the eclipse, and viewing it on your computer or another device will not harm your eyes. For much more information on eye safety during the eclipse, I want to turn now to our guest. Dr. Jeffrey Wallin is the acting dean at the Ohio State University College of Optometry. Dr. Wallin, welcome. I know many of us have heard or were told when maybe we were younger, never to look directly at the sun. And that warning is particularly important during this eclipse. Can you explain exactly what is so dangerous about looking at the sun and what specifically doing so can do to our eyes?
Sure, and I think you hinted at the importance of not looking at the sun on any day. The difference between a day with an eclipse and every other day is just that we are more likely to look at the sun during the eclipse, but we should never look directly at the sun. The damage that it can cause is similar to a sunburn on your skin. So just a few hours or minutes even in the sun can burn your skin. It can also burn the back of your eye, the seeing part called the retina. But there's a couple of important differences between the retina and the skin on your shoulder or on your arms. First of all, the skin on your shoulder or your arms can heal, and it heals relatively quickly. But the retina in the back of your eye cannot heal, so you can actually lose vision permanently. The other significant difference between the retina and the skin is that a sunburn happens on the skin over a period of minutes to hours, whereas on the eye, just like you said, it happens over a period of seconds to minutes. So even just a few brief looks at the sun can cause permanent damage to our vision. And so those are the important things to keep in mind, is that while it's similar to what happens to our skin, there are a lot of very important differences, and our vision is really important to protect.
Yeah, thank you, Dr. Wallin. You know, I talked about the importance of safe eyewear, making sure it has the specified ISO rating that I noted. And I talked about the option of watching the eclipse on NASA feed on an electronic device. Are there other safe options that people can avail themselves of, or other recommendations you would make regarding viewing of this extraordinary event?
Yeah, I think it's an important question. And really, I would say there is one other option for safely viewing it, and that is a pinhole aperture, something that you probably did in elementary school, where you just you can actually create it yourself very easily. There's instructions on the internet everywhere. Just simply have two pieces of cardboard, cut about a 1-inch hole out of one of those pieces of cardboard, put some aluminum foil over that, and then put a pinprick in it. Hold that one closest to the sun, hold the other one as far away from it as you can. It'll give you an image of the sun on the cardboard, and then you'll see the moon passing over it. So that's one way to safely view it. Other than that, there really aren't any other safe ways to view it. So I'll tell you, sunglasses don't help. You shouldn't ever stare at the sun, even with sunglasses. You should not use cameras to view the sun. Certainly should not use binoculars to view the sun. Sometimes they can even concentrate the rays that will burn your eyes. So really the only safe ways, I think, are the safety glasses. And you want to make sure that they're current. They're not the ones from the last eclipse, and that they're obtained from a source that you trust.
Thank you. We've referenced that we have information on our Ohio Department of Health website, but what other resources are available if people want to learn more about eye health and eye safety during the eclipse?
Yeah, the College of Optometry has some education that was actually provided to our optometrists so that they could teach their patients, as well as the media, about the importance of taking care of the eyes. And that goes a little bit more in depth into how the eyes are damaged. So that if people want that information, it's available. But also, like you list, important information about where you can purchase glasses from. And that can be found at optometry.osu.edu/eclipse. And then the Ohio Optometric Association, if you just Google the Ohio Optometric Association, right on their front page, you can see a link to their information about the eclipse. And I think those are two important sources, as well as the Astrological Association, that I think provides great information, and like you said, NASA.
Super. Thank you so much for joining us, Dr. Wallin. Well,
absolutely, my pleasure.
Before we wrap up today, I want to announce that the Ohio Department of Health has a new dashboard up and running on the state's Data Ohio portal called the Summary of Infectious Diseases in Ohio. This is a resource that greatly increases the amount of data available to the public. The dashboard includes data from more than 100 infectious diseases, such as measles, Legionella, and Lyme disease. And what's nice about it is that it is interactive. It can be easily filtered by county, time frame, by demographics such as age or ethnicity. And the data is available back to 2001, and it will be updated weekly. The dashboard replaces an annual report on diseases that was not available until about 18 months after the close of a year. So we're now giving people much more information, and in a much more timely manner. And we believe it's important that the public be as informed as possible regarding what's going on in their community and statewide. Now, we posted the link in the chat, and we also will be sending out a news release on this shortly after the press conference. So with that, Ken, I think we are ready to take questions that people might have.
Okay, thank you, Dr. Vanderhoff. A reminder to please ask only one question. And our first question today is from Spencer Hickey with Hannah News.
Thank you. Both of you made comments about cameras and other devices. Can those be used in combination with Eclipse glasses or specific solar filters in the case of cameras?
So I think for that question, I'm going to turn to the dean, as this is really his area of expertise.
Yeah, as long as there is an eclipse filter between the sun and your eyes, you can use the camera to do that. The thing is you won't be able to see the camera if you're wearing the Eclipse glasses. So you'll just have to take your best shot and then look down and at your camera to see if you got a good picture of the Eclipse.
Okay, our next question comes from Jake Zuckerman, Cleveland.com.
Hello.
Hey, Dr. Vanderhoff, how are you? Quick question for you, a little off topic. I wanted to follow up on the state's new reporting of non-fatal overdose data. I'm just trying to get a better picture. To what extent is that new? I mean, have health departments had any insight as to where non-fatal overdoses are occurring, or has it been partial? Can you just give a better sense of that?
Yes. So we of course have collected, we have received information about overdoses, but what this new capability provides us is a much more comprehensive view into non-fatal overdoses. Essentially, what we're able to do now, after a lot of very close work with providers across the state and the hospitals and emergency rooms across the state, who were very good partners in helping us organize this work, is assure that through our electronic medical records, which the vast majority of healthcare providers use every day, we will get automatic feed of that very important information when someone has been seen for a non-fatal overdose. And what's wonderful about that is it doesn't rely on human vigilance. It doesn't rely on a very busy provider who may be moving from one serious case to another to remember to fill out a form and send it to us. Rather, the EMR has that information and sends that automatically. So I think it's a great step forward. And we will be working with the Ohio Board of Pharmacy and others to now move towards providing that information at the point of care when providers might be prescribing medications that could be impacted by that history. So not there yet, but we're working very actively in that direction. So this is a very good development.
Thank you.
Okay, our next question comes from Tino Bovenzi with Fox 8.
Hey there, just wanted to follow up on the respiratory viruses, Dr. Vanderhoff. A lot of people that we've noticed have the sniffles. Maybe that's just allergies or the common cold, temperature fluctuation, that type of thing. All of your data is saying that respiratory viruses are trending in the right direction as it should at this time of the year. There's nothing alarming there. Could you just touch on that one more time?
Yes. So thankfully, we are seeing a decline in all of the major respiratory viruses. As I noted, flu activity in Ohio currently is still quite high. We're not in the very high category anymore. We've dropped from very high to high, but high is still a lot of cases. What that means is that here in Ohio, we still have to be very mindful of when we have upper respiratory illness symptoms, cold symptoms, cough, etc. When that happens, we are strongly recommending that people take really a common sense approach. Stay home and away from others, and don't re-engage with folks until your symptoms have been getting better for a full 24 hours. And that if you had a fever, that fever has been gone also for 24 hours before then interacting with other people. Now, the other thing I'd point out is that while respiratory season in Ohio is typically at its most severe in our fall, winter, early spring time period, and we're moving now from that time period into a warmer season when we typically see less of this activity. I'm sure as people remember, we have seen flares of particularly COVID-19 even in summer months. So the Department of Health will continue to monitor that very closely and will keep people well apprised. And one more thing I'd add is it's because we know that COVID-19 has demonstrated an ability to pop up during all seasons of the year that we are reminding people of the importance of staying up to date on their COVID-19 vaccine, including the new updated vaccine, which we need to think of as truly a new vaccine, different than the vaccine many of us received shortly after these vaccines first became available. And if we are over the age of 65, that is really a vaccine that requires a second shot. So again, attention, keeping our eyes on this, but being grateful that we are in fact seeing a decline heading into the warmer weather.
Thanks, Bruce.
Hey, our next question is from Eric Halperin with NBC4.
Dr. Vanderhoff, thanks for taking the time today. Apologies if this was already covered. My connection went out during the Eclipse discussion.
Yeah.
But the American Astronomical Society has put out a kind of notice warning about fake or counterfeit unsafe Eclipse glasses being out there.
Yes.
Is that a concern in Ohio? Is that something that you all have seen in Ohio?
Well, here's I would echo the recommendation that is coming from the American Astrological Society. It is very important that you are obtaining any eyewear that you're going to use from a trusted source. If you have questions about trusted sources, you have many places that you can turn to identify those. We shared some of those in our earlier comments. They include the Ohio Department of Health, the School of Optometry at OSU, the American Optometric Society, and others. What you should be looking for is glasses that you've obtained from a reputable source that have printed right on them the label ISO 12312-2. If your glasses are not both from a reputable source and don't have that printed directly on them, you should not use them. Dr. Wallin, what might you add to that?
Yeah, the only thing I would add, I think, is you might have glasses from the previous Eclipse several years ago. And if you do, they're not guaranteed to be safe. So I would purchase glasses specifically for this Eclipse. Because our vision is very important and we've got to do what we can to protect it. And we don't know for sure if there are problems with some of these glasses. And I can guarantee you, if you burn the retina or the seeing part of the eye, your eyes don't feel it. And it's too late by the time you actually know. So make sure you use appropriate glasses and use them safely.
Okay, our next question comes from Monica Robbins with WKYC.
Hello, Dr. Vanderhoff. Thank you so much for doing this. I want to go back to the respiratory illnesses. Are you guys hearing of cases? We're getting a lot of people, including myself, ironically, who've been diagnosed with a severe form of laryngitis, and it's lasting, 4 weeks to 6 weeks. Wondering if you're hearing of cases like this, or if this is related to allergies, the weather, what have you.
Well, thanks for that question. Laryngitis can be caused by a variety of conditions. One of the most common causes of laryngitis, especially laryngitis that is of relatively short duration, a week or two, are upper respiratory tract viruses. Now, there are a number of other things. Of course, you mentioned allergies. Allergies can also contribute to symptoms of laryngitis, but there are also some more serious conditions that can produce laryngitis, particularly long-lasting laryngitis. So my strong recommendation would be that anyone who has experienced laryngitis that is lasting more than several days really ought to see their healthcare provider so that they can have an appropriate comprehensive evaluation to determine what the likely cause is and what the best course of treatment or evaluation might be.
Thank you.
Okay, and our final question will come from our first reporter, Spencer Hickey. I know we have a 1 question limit, but we had him wait to the end and we have time. So Spencer Hickey with Hannah News, one more question.
Appreciate that. Could you speak to how the temperature will change and what animal reactions could occur during totality?
Yeah, thank you. Yeah, thank you for that really good question. So So the changes to our environment during a total eclipse of the sun can be really quite interesting and quite profound. If you are in the area of totality, you will experience total nighttime lighting. It will go from daytime to nighttime. And what's interesting about that is you might notice some of the animals in your yard or where you're observing this event acting like it's nighttime. So you might see animals that you would normally only see at night come out during this very brief time of darkness, total darkness. And as you suggested, we might also, depending on what the temperature is that day, ourselves physically feel the cooler temperature that we associate with evening as opposed to daytime. And that's, of course, because our major heating source for our environment, the sun, now has been blocked for a window of time. Dr. Wallin, what else might you say about this?
Yeah, people have asked about safety for their pets. Should they put them inside during the eclipse? And really, pets aren't curious about the eclipse, so they're not more likely to look at the sun on a day of the eclipse than they are on any other day. So I don't think we need to get eclipse glasses for our dogs or put them inside. They should be fine through the eclipse.
Okay, thank you again for joining us. And Dr. Vanderhoff, do you have any closing remarks?
Thank you, everyone, for joining us. We appreciate your attention to these important health topics, including the importance of eye safety during the exciting upcoming total eclipse event that's going to impact so much of our state. Thank you, and we look forward to the next time.